ঠিক আছে? এবার today I will be discussing the testes. Now, the male reproductive organ. আর এখন তোমরা শোনো, আমার কথা না শোনো যা হচ্ছে, আমার রাগ অভিমান নেই, হ্যাঁ, কারণ কিন্তু তোমরা এখন জল 4 লিটার খাবে, and just don't sip. Between sip and drinking is, you have to, আমাদের যখন your marriage is there, so from they are given that, all that lota, thala and all this. So there's big glass is given, and especially in Bengal, every state has the same ritualistic practice, and because even the husband is given, the daughter is given also. So, but nowadays, a major part of your suffering, especially females, they are drinking less water. What? Just sip. In a whole day, you just sip, you just quenching thirst in this level. But you take a glass, you dhalo, khao. So, just I'm telling you, you have to hydrate yourself. You drink anything, but you hydrate. Now, because you have to live for yourself. You have to give good result for yourself, not to please your mother, your boyfriend, or anyone. You have to live for yourself. Be selfish. So you just have to live for yourself. Now, this one thing I'm telling you, I'm trying to see that testes are paired of ovoid masses, organs that lies in the sac of the scrotum. The testis develops from intermediate mesoderm. This mesoderm of genital regions in the abdomen migrated primordial germ cells of the yolk sac. Later, testis descends to lie in the scrotum. Now, this is important because amongst you, there will be some gynecologists there. There might be some andrologists. So, a couple comes or couple does not come. In our Indian scenario, most of the married couple, if there is a woman with no children for sterility, she is coming. 1 year past marriage, everyone wants to boom, bacha hoche na. So the woman is फांसी में फंदा, चढ़ा दो woman को, lady को. This is one thing. It's practically the same scenario throughout India. Though I have not traveled throughout India, but I had the opportunity to see different types of patients from different states. Now, Bihar, Jharkhand, and Bengal. So, one thing is that, तो बहू को पहले एग्जामिनेशन करते हैं. So the bahu comes and you examine, and after 2 years marriage or 1 year marriage or 3 years marriage, if you are married, everyone is expecting a child. You are not expecting, or you are not hoping even also for first 2 years or 3 years. Now, but if any lady comes, you see her first, and then you see, and you put some battery of tests that is required. That is ultrasonography, hysterosalpingography. I lectured on uterus. I showed you the different shapes of the uterus. Now, if there is any problems of menstrual disorders, so you have to go for hormones test. thyroid and all FSH, LH, testosterone, and all this. Histology notebook means it is this thing. It comes so important that a lecture is being ignored. मेरा काम है बोलना, हम बोल जाएंगे, बोलते रहेंगे। Anyway, না আমার বক্তব্য হচ্ছে শোনো, তোমরা যদি এসে 10 মিনিট রেস্ট নাও, জল টল খাও, হ্যাঁ তুমি এখানে মানে ডোন্ট ওয়েস্ট ইয়োর টাইম। আমার কিছু নেই, আমার ইমিউন হয়ে গেছে, আমার শরীর ইমিউন হয়ে গেছে, আই এম ইমিউন, আর আমি বলে যাব, ঠিক আছে? যদি তোমাদের 150টা ছেলের মধ্যে আমার 25টা ছেলে মেয়ে তৈরি হয়, আমার কথা একটু শোনে, 10% শোনে, তাতে আমি আই উইল বি হ্যাপি, ঠিক আছে? One thing I tell you now, see, one interruption delays everything. Now I'm telling you, now the woman is examined, then who's brought her? Her mother-in-law. तो बोलो कि आपका लड़का, बोलो उसका कुछ समस्या नहीं है, उसका कुछ तकलीफ नहीं है, वो मेरा बहू का एक तकलीफ है। Now, but you must insist that the man should be examined. You must insist as a doctor or physician, even a plain MBBS, when they come to you, you have to advise and send to some person or get everything ready, and then you advise them to go. And then on the second visit, you must be firm. Now you have to bring, you don't come. Please, you don't come. Don't be rude. But you have to say, please don't come, bring your son, send your son with the bahu. So you just crack a joke, अरे आप तो लड़का का शादी दिया कि वो अकेले चल सके, तो उसको भेजो. So next, now why I'm telling you that after marriage, it might be 2 years, 7 years, 14 years, people are coming with the problem of sterility. After you examine, with the first encountering a patient, you advise for a semen analysis, because that will give you the clue for many things. It might be that the sperm count is less. It might be he has an undescended testis, or there might be small testicles, it's not grown as it is required. So these patients should be treated and also be assured. You don't be just create fear. नहीं, आपका बहुत बड़ा ये है, first day you write IVF. No. Because IVF centers or people who is doing a gynecology or MD or DGO, they are writing, they might be trained, but that is a very precision and very good lab you should have. So you have to refer to your friend who is working in an IVF laboratory where they will go for this procedure. But for 3 months or 6 months, you just give treatment according to medical treatment, or you need an andrologist's help. So you send the patient to the andrologist and then get things in streamline. Your work is to streamline the patient. Because I'm telling you, this is such also the environment, also the meeting of the husband and wife in the cycle when the ovum is ovulation has taken place, the ovum comes out. But at this period, after menstruation, 10th day, 11th day, 12th day, 13th day, 14th day, 15th day, on this period, we expect that fertilization will occur. So you have to be a psychologist also. You have to gauge the inner feeling. So you take the individual, first the lady is examined, and then the male. Now why I'm telling you this? Because the woman is also always brought first, and also the male is reluctant to be tested. Even educated people. It might be a college teacher, or it might be a school teacher, working woman, or working men, or it might be any agricultural laborer or common people. So you have to, as a doctor, you have a role to say, no, you insist. Because you have to ask the questionnaire. You have to make a questionnaire. And what are their sexual feeling? Now myself, I was married in 3rd year, and my first baby was after 7 years, but we didn't have any problem, any functional disorders or anything. Now why? That's a big question. Why 7 years of marriage you were not getting a child? Actually, we did not meet frequently. I used to come in weekends. Naturally, we did not meet frequently. But once I went to Delhi, only to pursue anatomy MS, we used to meet, talk, everything. Now, this is one thing I'm telling you, that first baby was Vaishakhi, and second baby, Sagata. I have 2 beautiful grandchildren. They are both daughters. Now, with this thing I'm telling you, that you have to feel for the patient. You have to feel it, because unless you be on the patient's side, I mean, when you're a doctor, then sometimes you become a patient also. It might be not for sterility only, but I'm telling about your anything, your peptic ulcer perforation, or your colitis or steratory area, then you have to, or hemoptysis, which is a very common, and also your hematemesis. So you have to be compassionate, and you have to boost up and tell things which is, even if you are not, you being a doctor, read Kama Sutra, and you see some magazines, you must read it. It is not that, जो 3 बंदर है ना सुनता ना देखता है, जो बंदर है, don't be बंदर. You have to this thing, because you have to coach them. You cannot, you see in Sian, you just write a prescription and tell, তুমি চলে যাবে কলকাতা andrologist কাছে. So you have to do a backup study. Though you are a gynecologist, at least how many andrologists are there in Bengal? I think 10 मिलेगा, 10 मिलेगा. So one thing I'm telling you, plus in prescription, what I write, I would say, you ask the lady that, do you have, তোমার ইচ্ছা হয়, ইচ্ছা, না আমার ইচ্ছা কম, তো তোমার হাজবেন্ডের, না ও ঠিকঠাকই আছে, এটা হলো। তারপরে আবার হাজবেন্ডকে জিজ্ঞেস করলে, না আমার ঠিক আছে, আমার প্রিম্যাচিওর ইজাকুলেশন হয়ে যায়। You open up the bond and go. And what I do is that in my prescription is that if it is good or very good, then I put an arrow. If it is less, then I put like this. Icha. Similarly, I do this or do this. In a lady's prescription and a male prescription, whatever it is, I write it because actually, accordingly, I have to gauge the day one, the prescription, how, and also you give some advice. This is one thing. You have to be learned. You have to be compassionate handling a sterility patient. Okay? You see, we are in Bharat, we are in India, Bharat, whatever you say, that you see all temples, Konarak temples, you see Madhya Pradesh, Khajuraho temples, you go to Gujarat, you see the temples of Gujarat, you go anywhere, the sculptures, they are depicting some sexual activity. So you have, but this doesn't relate with your histology text, but it does. Because after this, just 5 months, you will go to pathology and you will be seeing some histological, the pathological slides of testes. So you have to, now the next, now structure of the testes. Now structure of the testes is the tunica albuginea, tunica vasculosa, collective septa and lobules, mediastinum testes, seminiferous tubules, lytic cells, interstitial cells, straight tubules, tubular recti, reti testes, and efferent ductules. Now this is the, you will see the picture of the testes, and accordingly, next. Now microscopic structure of the seminiferous tubules, epithelium, seminiferous epithelium. Seminiferous tubules are lined by complex stratified epithelium called seminiferous epithelium. It consists of two types of cells, Sertoli cells and spermatogenic cells. Each seminiferous tubule is approximately 50 centimeters long and 150 to 200 microns in diameter. Now this is the picture. Anyway, we've gone back. Just I run through. A male reproductive system consists of pair of testes, genital ducts, epididymis, ductus deferens, ejaculatory ducts, accessory sex glands, seminal vesicles, prostate, bulbourethral glands, and male urethra, penis. The main functions of the male reproductive organs are production of sperm, spermatogenesis, production of sex steroid hormones, testosterone, helps in deposition of sperms in female reproductive tract. Now, this is the thing, initiation of the male reproductive system. Now, see the parts of the male reproductive system. This is the urinary bladder, the symphysis pubis, this is the erectile tissue of the pelvis. Now, this is the urethra, this is the testes, this is the vas deferens and epididymis, testes, scrotum, and these are the vessels. Now you see the bulbourethral gland is here, and see the seminal vesicles which secretes the seminal fluid, and the prostate gland. This is the urethra from the bladder. Now this is the parts of the male reproductive system, heads of the epididymis. This is the head of the epididymis. Now this is the tunica vaginalis, tunica albuginea, and tunica vasculosa. Tail, body of the epididymis, this is the tail, this is the head. Now, seminiferous tubules, reti testes, efferent ductules, and vas deferens. Now, this we have, now microscopic Sertoli cells and spermatogenic cells. This is what you will see in the, we have two slides in testes. You see that, compared with the histology textbook, move. And Tara 12টা 12:15 বাজছে, তোমরা শুনবে না কথা, তোমরা 12:30টায় বেরিয়ে যাও, দেখো। সবাই দেখেছি? হ্যাঁ দেখেছি। কার চোখ দিয়ে দেখছো? আমার স্ত্রীর একটা আকাশ ভালো লাগে, আমার নাও ভালো লাগতে পারে, ঠিক আছে? ব্যাচ বাই ব্যাচ যা, দেখে নে, নাহলে তখন তুই বলবি স্যার কি আমাকে দেখতে হবে, ইউ ওয়ন্ট হ্যাভ দি টাইম ইভেন। আর খাতা লেকচার থিয়েটারে করবে না, বায়োকেমিস্ট্রি হোক, প্যাথোলজি হোক, বায়োলজি হোক, এগুলো করবে না, সময় নষ্ট। যা পাবে দেখবে, যা বলছে হ্যাঁ শুনে নেবে, 30% কাজে লাগবে। যখন তুমি ক্লাসে ডিসেকশন করবে দেখবে যে 30% কাজে লাগলো। আমি 30% বললাম, আমি 100% চাইছি না।